How can you fine-tune your workouts to naturally raise your testosterone levels? I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to walk you through everything we currently understand about boosting testosterone through exercise. We'll cover how your body makes testosterone, how hard your workouts need to be, which types of exercises are most effective, and the right order to perform them, whether you're focusing on resistance training or endurance work. Finally, we'll discuss the long-term effects on testosterone, along with factors that might limit your body's ability to naturally produce more of it. So, how is testosterone created? About 95% of testosterone in the male body is produced in the testicles, specifically by specialized cells known as Leydig cells. The process begins in the brain, in an area called the hypothalamus, which releases a hormone known as gonadotropin-releasing hormone. This hormone signals another part of the brain, the pituitary gland, to release LH. LH then travels to the Leydig cells in the testicles, instructing them to produce testosterone. Once produced, testosterone moves to various cells throughout the body, including muscle cells. Inside these cells, it binds to something called an androgen receptor. This connection triggers a chain reaction that activates genes, leading to the production of proteins and essential building blocks your body needs. Now, how does exercise actually increase testosterone levels in the blood? When you work out, your body releases both catabolic and anabolic hormones, those that break tissue down and those that help build it up. Testosterone is one of these key hormones. This rise in testosterone also increases the activity of androgen receptors, which then boosts protein synthesis. The idea is that after exercise, testosterone levels rise significantly, which helps extend the lifespan of androgen receptor mRNA, the genetic blueprint for these receptors, making it more stable and effective. This increases the chances of hypertrophy, or muscle growth. However, it's important to understand that there appears to be a certain threshold of effort or workout volume you must reach to trigger this testosterone boost. So let's break it down. We'll look at workout intensity, the number of sets and repetitions, the order of exercises, and how much rest you should take between them. So let's begin with resistance training. This type of training has been widely studied, and there are a few key terms you should understand. Intensity refers to how challenging the exercise is, and it's usually determined by how much weight you're lifting. A repetition maximum is the highest amount of weight you can lift for a specific number of repetitions. And volume of work, which, as I mentioned earlier, is a major factor in boosting testosterone, includes the number of sets, the repetitions, and the intensity combined. Let me give you a simple example. If you perform 5 repetitions of an exercise using 100 pounds, and then later do 5 repetitions with 150 pounds, you've increased the intensity. On the other hand, if you go from 5 repetitions at 100 pounds to 10 repetitions at the same 100 pounds, then you've increased the volume. And that also plays a role in testosterone response. Now, when it comes to which types of exercises actually raise testosterone, there have been a couple of larger studies. In one, participants performed 3 to 5 repetitions of 3 lower body exercises at 100% of their 6 repetition maximum, meaning they were lifting the heaviest weight they could handle for 6 reps, repeated across 3 exercises. Another study looked at 5 sets of 10 repetitions using a 10 repetition maximum. Rather than focusing on the exact numbers, the key takeaway is this. You should be working with your true repetition maximum, using the heaviest weight you can handle for the full set. What about endurance training? Endurance exercise can increase testosterone, but typically only in the short term. For example, short bursts lasting 2 to 5 minutes at about 90 to 100% of your VO2 max, the maximum amount of oxygen your body can use during exercise, can temporarily raise testosterone levels. To measure your VO2 max, you would usually need a stress test at your doctor's office or visit a specialized exercise medicine clinic. However, with endurance training, you'll often see an early rise in testosterone followed by a drop. This happens because prolonged aerobic stress causes your body to release cortisol, a hormone that can suppress testosterone production. As a result, testosterone levels may decline, especially in high-level endurance athletes. In fact, elite endurance athletes often have lower testosterone levels because their bodies produce what are called reactive oxygen species in response to ongoing physical stress. These reactive oxygen species can actually interfere with the brain signals that tell the testicles to produce more testosterone. So, when you're deciding between resistance training and endurance training, resistance training is generally the better choice if your goal is to boost testosterone. There have also been some smaller studies looking at high-intensity interval training, or HIIT, which do show improvements in testosterone after these workouts. However, much of the research suggests that these increases only last for about an hour, or a short period after exercising. Some studies have shown that testosterone levels can stay elevated for up to 48 hours after a workout. But it's important to understand that a single session of resistance training will not keep your testosterone levels high over the long term. Now, what about the number of sets and repetitions? As mentioned earlier, total work volume is what matters most. This means you can adjust the number of sets and reps as long as you maintain high intensity and achieve the same overall workload. What about training to failure? One study explored this by following 40 men divided into 3 groups. One group trained to failure, meaning they exercised until they couldn't perform another repetition. Another group trained without reaching failure, and a third group did not exercise at all. The results showed that those who did not train to failure had better improvements in lower body strength and power. Meanwhile, those who trained to failure improved more in the number of repetitions they could perform on the bench press. But what about testosterone levels? The group that avoided training to failure had lower cortisol levels, meaning less physical stress, and they also had higher testosterone levels. This suggests that constantly pushing to failure may not be the best approach if your goal is to support healthy testosterone. So yes, resistance training is the most effective, but what type should you focus on? As mentioned earlier, intensity is key, but you also need to target large muscle groups. If you're only working small muscle groups, even at high intensity, you're unlikely to see a meaningful boost in testosterone. For example, a jump squat, which engages your lower body and core, tends to produce a greater increase in testosterone compared to exercises like the bench press. In the same way, movements such as squats and Olympic lifts can lead to a stronger rise in testosterone levels. What about free weights versus machines? When researchers compared the two, they found that free weights led to higher increases in plasma testosterone than machine-based exercises. This is likely because free weights require additional muscle groups, including your core, to stabilize the movement, while machines are designed to isolate specific muscles. Now let's talk about rest periods. How long should you rest between sets? In a study examining intensity, number of sets and repetitions, and rest intervals, researchers found that moderate intensity, higher volume, and shorter rest periods resulted in greater increases in testosterone. Specifically, resting for 60 seconds instead of 90 seconds led to better improvements in total testosterone levels. So, if you plan to include both resistance and endurance training, which should come first? Based on how hormones respond, you'll want to start with exercises that use large muscle groups and help raise testosterone early in your workout. For the best and most sustained boost, begin with resistance training that targets large muscle groups, and then follow it with endurance training. Finally, what about your baseline testosterone levels? That is, your levels at rest when you're not exercising. Does resistance training improve those levels over time? At this point, the answer isn't completely clear. However, some research shows that with repeated sessions of exercise, such as a study that examined 3 separate workout sessions, there were consistent increases in total testosterone after each session. So we do know that resistance training can improve testosterone levels when performed consistently. If you're exercising regularly, no matter the type or intensity, it doesn't appear to create a long-term increase in your baseline or resting testosterone levels. However, some smaller studies, especially in individuals who are overweight or older, have shown improvements in baseline testosterone. One possible reason for this, particularly in overweight individuals, is weight loss. As they lose body fat and reduce waist size, testosterone levels may naturally rise as well. So, if you want to keep seeing those testosterone benefits, you need to stay consistent with resistance training, which is exactly why skipping leg day isn't a good idea. Now, what if you're doing everything right, following the proper workouts, but still not seeing results? There are a couple of factors that can make it harder to boost testosterone. The first is obesity. Obesity can lead to problems with blood vessel function, meaning blood flow to and from the testicles may not be as efficient. As a result, the testosterone response may still occur, but it might not be as strong as it would be in someone with a leaner body composition. The second factor is age. A man's ability to produce testosterone typically peaks around age 40, and after that, it gradually declines by about 1 to 3% per year. This is a natural part of aging. The cells in the testicles responsible for producing testosterone, called Leydig cells, become less responsive over time to signals from the brain and pituitary gland. So while older men can still increase testosterone through exercise, the response is usually not as strong as it is in younger men. But here's the key takeaway I want you to remember. Regardless of your age, weight, or other health conditions, there is solid evidence that resistance training, especially using large muscle groups, moderate to high intensity, shorter rest periods, and higher overall volume, can increase testosterone levels. So once you finish this video, get up and try a few jump squats. You can do them right at home, no gym required, and start giving your body that natural testosterone boost. And as always, take care of yourself, because you truly matter.